Welcome to the Global Goals Studio at Davos Agenda. I'm Richard Wolff. The pandemic has exposed some cruel realities about the health of humanity. While our health systems have been forced to contend with the impact of the coronavirus, they've also revealed underlying health inequities that leave the most vulnerable communities at even greater risk. We cannot really recover from the pandemic and prevent the worst effects of future pandemics without improving healthcare across the planet. To discuss what we've learned about global health equity, we welcome now Mark Suzman, CEO of the Bill and Melinda Gates Foundation, and Eddie Ndopu, SDG advocate and global humanitarian and activist. Mark Suzman, the Gates Foundation has long prioritized vaccinations to eradicate diseases like polio, but you pivoted sharply to the COVID-19 vaccine as the pandemic took hold. Tell me what those investments have looked like in terms of COVID-19, what you focused on, and how they fit into the other work of the foundation, tackling extreme poverty.
Yes, well, today is actually the launch of Bill and Melinda's annual letter. And it's titled this year, The Year Global Health Went Local. And it's literally a year ago this week, we made our very first grant for COVID, which was a $10 million grant to actually help support the African Centers for Disease Control and Prevention, provide African countries with the capacity to start testing for COVID. Not a single case of COVID has yet left China at that stage, but we thought that was critical for prevention. Flash forward a year, we've now spent $1.75 billion on a disease nobody had heard of a year ago. And it really is drawing on the expertise we've built over the years working on infectious diseases like polio, like tuberculosis, like HIV/AIDS, and taking that knowledge both in the research and development, how can we accelerate searches for vaccines, therapeutics, which are the treatments, diagnostics, but then also, which is our core mandate, how do you make sure those get used and utilized by the poorest and neediest, both within the United States here, where we have massive inequities, and around the world. And so those investments have gone from the COVAX initiative to try and provide vaccines to poor countries, right down to supporting grassroots efforts in places like Bihar and Uttar Pradesh in rural India.
Eddie and Ndopu, when we think about the neediest, the people at greatest risk, the numbers tell us that there are over 1 billion people on the planet living with a disability. That's roughly 15% of the population. How has the pandemic disproportionately affected our brothers and sisters living with disabilities? And what do you think are some of the health equity challenges in particular they're facing now?
People with disabilities constitute the world's largest minority, and the fact that this segment of society has not been explicitly named and explicitly accounted for in the discourse around COVID-19 speaks to the fact that those who are furthest behind the line of opportunity, those who are most marginalized, continue to not be part and parcel of our recovery process. And so as we think about what the global recovery might look like, it really is incumbent upon all of us to ensure that when we speak about equity to healthcare, that we also speak about equity to health as a state of being, and really underscore and validate the lived experiences of the people who are most marginalized in society. There is a correlation between social injustice and various inequalities that manifest within the healthcare system. And so in order for us to have health equity, it really becomes important that we think about how the larger society sort of reproduces these problematic dynamics in the context of the provision of healthcare.
We're going to take a quick break here. Please stay with us. You're watching the Global Goals Studio.